That's right. Once again, we're joined live via Skype with Dr. Dana Hawkinson with the University of Kansas Health System. Doctor, as always, we appreciate you spending some time with us early in the morning. When and how should officials decide to end or extend a stay-at-home order? Obviously, we know this is not up to you. This is being made on different levels here, the people who are elected to do these jobs. But when would you suggest doing that and that kind of rolling order be done?
As far as lifting the order, yeah, I think we need to continue to get the data and the information and the numbers, just as Mayor Lucas was talking about. He's been on the forefront along with Governor Kelly and Secretary Dr. Norman. I think we need to kind of wait until we can get the most numbers, the most data we can, and that might be until the 11th hour. But we have to take all those things that Mayor Lucas was talking about into effect, not just for Kansas City, Missouri, but for the whole area and region. How many cases? Have we had a surge? Do we still expect a surge? So many of those questions still are not answered. So I think we still need to wait on the numbers, on the data, and do it at the safest time point, but also taking into account our economy and trying to get businesses up and running again. So I think we still need to wait a little bit longer.
Doctor, do you think that's something we could learn over the next couple of weeks? Over the weekend, Dr. Fauci said a rolling reopen could be possible in some parts of the country as soon as May. Do you think that's realistic for the Kansas City area?
I do, and that's for the KC area, not necessarily St. Louis per se, because we have a different dynamic here than they do. Same thing with Denver. We have hopefully been able to flatten the curve a little bit with our early stay-at-home orders. We are seeing about the same number of patients in the hospital. Again, we still don't know the full extent of the infections because we don't have widespread testing. But the way it's looking like now, certainly our situation seems a lot better than New York, Detroit, even St. Louis or Denver. I think we're doing well now, but we still need to wait as long as possible. And I think we have that time to wait because some of those orders still are not up for another week to 10 days.
Doctor, we learned yesterday of a Kansas City first responder dying because of coronavirus. They're calling this a death in the line of duty. They're believing at this point that he may have contracted that from a patient, from another person that he interacted with. How do we make it safe whenever we have to call someone to our home, whether it be coronavirus or something else, if there's an injury around the house, that kind of thing? How do we make sure both the person responding and we stay safe?
Yeah, I mean, you can certainly, when you call, and like you said, if you have a fall or something like that, when you're calling for EMS or 911, explain the situation. Certainly now, I believe all first responders are taking those precautions. And so when they're doing that, they're wearing proper PPE. They're taking the precautions that you may not have symptoms, but you could be sick, as we all should be doing, because we just don't know at this point. You could be asymptomatic or pre-symptomatic and still be able to spread the virus. So I think it's really incumbent on those first responders to really go back to their training, use their PPE, and also putting it on and taking it off correctly as well.
As always, Dr. Hawkinson, thank you so much for your time. We appreciate that information. Thank you for joining us this morning.